played this here to get an update on President Trump's condition from Walter Reed Medical Center.
Concern that they took him to Walter Reed Medical Center aboard Marine One. Power remains with the president. Again, they have not transferred power to Vice President Mike Pence. The White House continuing to say the president was simply transferred out of, quote, an abundance of caution, and that he'll be there for a few days. Before today's briefing, details have actually been pretty hard to come by regarding the president's condition. We were told he had mild symptoms with a low-grade fever, and that he was being treated with an experimental drug cocktail. The president's physician, Sean P. Connolly, released a memo Friday afternoon saying the president has received a single 8-gram dose of Regeneron's monoclonal antibody cocktail as a precautionary measure. The news has moved fast following the president's diagnosis, very fast. Overnight, we learned President Trump's former aide Kellyanne Conway and his campaign manager Bill Stepien have been infected. They joined 2 members of the Senate Judiciary Committee, First Lady Melania Trump, GOP Chair Ronna McDaniel, and longtime aide Hope Hicks. That has brought huge attention to this White House Rose Garden ceremony held 1 week ago.
Given to the president this experimental cocktail and what is an FDA-approved remdesivir, and how these things were presented to the president.
Yeah, this is a really good question. I mean, keep in mind, Fred, just by way of background, we heard the president was doing well, and then almost, the next thing we heard was that he was receiving an experimental monoclonal antibody cocktail. That's not something that's even has emergency use authorization yet. It's got a lot of optimism around it, but it's truly experimental and would have been given under compassionate use. Question I would like to know is, why was that decision made?
And who made that decision?
Doing well, was there some particular reason? Who made that decision? And as you asked, what was how was it presented to the president? We want to give you this experimental cocktail. It's not even authorized under the EUA. We want to give it to you under compassionate use. Here is why. Here's what we expect it will do for you. I'd be curious if the doctor talks about that conversation, because ultimately the president had to agree, I'm going to take something that doesn't even yet have emergency use authorization. Was that because of a heightened level of concern, or what was going on at that point? That must have been a discussion happening in the White House involving lots of people. How did it get presented?
Yeah, and the president would be extended any and all things, particularly at Walter Reed there. But what is that?
Explored, of course, the story comes to life, and now
I never knew how my blood pressure and my blood
I'm not treating patients, of course, but what we have seen before, our physicians right now are getting much better at treating COVID-19. Some of the complications that may happen needs to be in a hospital. The key issue, again, to keep in mind for all of us is his ability to breathe on his own, or does he need to be incubated?
Doctor, this is just me noticing something. When I flip around and watch others, some people say the president's morbidly obese and all that. To me, he looks just maybe a little overweight, but even the obese thing seems like a stretch. But some pretty vindictive thin guy came up with the morbidly obese thing. So what do you look for in that pool of patients? What makes it more problematic for not only COVID-19 recoveries, but treatments?
So for treatments with obesity, of course, and again, the president, I don't think is morbidly obese, but also you're looking at if somebody has diabetes, cancer, cardiovascular diseases, any other health problems that clearly the president doesn't have, so this is going well for him. His age is above 65, so that's another risk factor, and he is a male. Unfortunately, males have been at a higher risk for COVID-19 and mortality as well, even when they are in a hospital. So these are the risk factors that we worry about. He doesn't smoke, so which is good, very good. So we will see. We will see what the physician will say in a few minutes.
All right, we look forward to that. Doctor, thank you.
because of the amount of unknown factors that are present.
Yeah, Alex, that's exactly right. And it's good to be with all of you on a, pretty crazy week. What we're hearing from Republican sources in kind of all parts of the party is that this is a pretty chaotic time, that they don't feel that this is good for them politically, that they are worried about what's going on. But what's really interesting, Alex, is that this moment is kind of becoming the new what did they know and when did they know it moment. That obviously is a big conversation we've been having after Bob Woodward's book came out, and we hear the president talking about the way in which he intentionally downplayed the virus. Now we're stuck kind of putting together pieces about who was in the room with these folks, who was in close contact with these people, who knew what, when, and who was intentionally putting other people potentially at danger of contracting this virus because they were making these decisions in bad faith.
Yeah, and Yamiche, to that point, we do know that top White House aide Hope Hicks went to the rally with the president on Wednesday, and it's been reported that on the way back from that rally, she began to not feel well, potentially showing some symptoms of COVID-19, for which she was diagnosed shortly thereafter. The extent to which this could be called a super spreader event, all of these cumulative events with the president, who's really bounced around to so many campaign entities this week. What is the concern in terms of just contact tracing? It's got to be just a huge lift to try to get to anybody who may have come in contact with not only the president, but anybody else in his inner circle.
It is a huge lift to look at contact tracing, because when you look at the president's schedule, he was traveling extensively and a lot of events with different people, in rooms with different people. He had at least 4 rallies over the last few weeks in Florida, in Pennsylvania, of course in Minnesota. The critical time that we've been looking at is that time when Hope Hicks started feeling sick, where she was diagnosed on Wednesday night. The president knew that she had been diagnosed, and he still went then to New Jersey and held a fundraiser there. That's remarkable. I've been pressing the White House to ask questions about why the president, when he knew that he had been exposed to Hope Hicks, why he got on a plane and continued traveling. They say White House operations said that that was okay. It's still unclear who actually made that call, who was White House operations, who thought it was a good idea for the president to continue traveling. And of course, there's so many questions for this White House doctor. Who do they think gave it to President Trump? How is he actually doing? What is mild symptoms? We've been hearing, of course, from reporting that he has a low-grade fever, that there's nasal congestion, but we haven't heard officially from the White House how is the president actually doing, other than saying he's in good spirits, he's feeling well. Another thing to note is that the president, as Robert noted, is eager to be out on the campaign trail. So this is the president who understands optics. It had to be serious enough that the president understood that he was going to be medevaced from the White House on camera and going to Walter Reed. That's a big decision on his part. Of course, this also upends the campaign, because the campaign manager, Bill Seppian, is now having to quarantine. So they're still trying to have a campaign. There's some reporting now that Mike Pence is going to be hitting the road. He tested negative again this morning, a White House official tells me. But this in some ways really upends all of the things that the president wants to do, and it underscores that the White House was not modeling good behavior, not wearing masks, not social distancing at a lot of different events.
Yeah. Dr. Redliner, I have seen headlines that use
others that complicate this particular case for him. Can you talk more about that and how it impacts his treatment at Walter Reed right now moving forward?
So when we look at data across the country, so this is in the thousands and thousands of people who've been infected or tested positive with COVID-19. A subset of them get very ill. And when you look, those are people who are male, almost twice as likely, more than twice as likely than women. Those are people that are older. The older you are, 70 to 74 has a significant hospitalization rate, 75 to 80 dramatically higher than that. And people who are overweight also has a significant bearing on the outcome with COVID-19. And so the president has 3 risk factors that put him at higher risk for complication. That being said, anybody can have complications from this, and we've seen it in teenagers, we've seen it in 20-year-olds, but they're more likely in those. And, just so what was built on, a few minutes ago, totally accurate on the testing, right, is that when you breathe in droplets from this virus, they go into the lung and they can be resident there. And they have to get to a certain level. It's When you breathe them out, you can find them in the nose, you can find them in the mouth and elsewhere, and that test, that PCR test, turns positive. So there's a period, the incubation period, where you have the virus anywhere from 2 to 14 days to get to enough virus that the test turns positive. So a negative test means just that. You're negative at that moment in time, and probably not infectious that moment in time, but doesn't say what's going to happen in 24 hours.
Major Garrett is on the phone for us. Major, what are you hearing right now?
Well, there are several things that we've gone over this morning that the White House physician must explain to the American public. And Jeff, you made a mention to Chip Reed that the information is coming out a little bit more frequently, but by any historic standard, this White House is dramatically behind the information curve. In the last 24 hours, the president has been given 2 different treatments. That's a significant intervention by my layman's point of view. I defer to Dr. Agus, but 2 things have been done to the President of the United States in response to a positive COVID-19 test. The American public needs to know what the decisions were behind with both of the interventions, what they are seeking to accomplish, what is the current state of the President's health in specifics, and what is the expected reaction of the body in the next 24 to 48 hours. These are not incidental medical matters, and they are very much related to matters of state. The stability of the presidency, the workability of the presidency, the health of the President of the United States, and the future direction of the country. I'm not hyping any of those things. These are central to the information flow that must come from the White House to the American public. And I certainly hope that the briefing that we are now anticipating outside of Bethesda Naval Medical Center will be extensive and cover a lot of this ground. It would be
day. The last update that we got from the White House was that the president was in good spirits, that the reason for this trip was out of an abundance of precaution. But of course, as we just noted, part of the reason that the president decided to come here at the time that he did yesterday had a lot to do with the message that he wanted to send to the American people, that he was still in good health, walking of his own volition to Marine One, coming here. We're still waiting for this update. Last we were told it was just minutes away. And the last we heard, the president was only experiencing mild symptoms related to COVID-19, congestion, a low-grade fever, as well as fatigue. So obviously we are eager to hear what Dr. Sean Conley, the president's physician, has to say.
Right, the first message from the White House out of an abundance of caution, as you note, but then now, according to sources, his condition has accelerated to, far more concerning symptoms. So Sanjay, back there's been no transfer of power, from the president to the vice president. You just heard from our Ryan Nobles about the campaigning plans. The vice president still expected to debate, coming on Wednesday. We don't know what kind of adjustments might be made, to that arena of debate, but that the vice president would still continue to go according to schedule to a rally or a campaign stop. What's your concern about the message that the White House is trying to send, a message of normalcy when we have a very serious, potentially very serious situation here?
Well, I think there's a practical message here in that, the vice president, we don't know what his specific exposures have been. The guidance and I think the sort of agreed upon CDC recommendations, if you've had exposure to someone with known COVID, and again, the exposure, if you want to define it more precisely, if you've been within 6 feet of somebody for longer than 15 minutes without a mask on, that would be considered a close contact. So, for the vice president, if he's had that sort of contact with anybody who then subsequently tested positive for COVID, that's a concern for him, and the guidance recommendations would be that he be quarantined, and that's irrespective of whether or not he's had a negative test. As I was just saying, you could have an exposure, and likely you wouldn't test positive after that exposure for several days. The virus has to replicate and become detectable in the body. In fact, we can show this graphic quickly if we have it, in terms of what happens in terms of the exposure and the symptoms if we have that. But typically it's several days between exposure and then when someone develops symptoms. So you see, Fred, we're really talking about that time period in between infection and symptoms there. My point is that the vice president, hopefully he does not ever test positive, but the fact that he has tested negative now after exposure to some of the folks who have COVID doesn't mean he's free and clear. The guidance, that's why they say people should be quarantined after that so that they don't continue to spread the virus.
You know, we also have a photograph, hopefully we can pull it up, of that Rose Garden ceremony and the placement of where the vice president was sitting in proximity to other people who have since tested positive. And talk to us, explain to people about, you know, earlier in the week, or I should say really within, you know, Friday's period, we heard the negative test right there. You know, Vice President is in front row seat. Senator, you know, Mike Lee, not far away. Kellyanne Conway, not far away. You talk about the 6, you know, foot proximity. While the Vice President at first tested negative, explain to people why another test, because of, you know, potential, you know, false reads of the first negative, why it's important to have yet another test. And we're learning today a second COVID test for the vice president, testing negative, but you also underscore it doesn't necessarily mean, you know, that somewhere down the line he may have to be tested again.
Yeah, exactly right. I mean, so if whatever event it is, in this case the Rose Garden event, if you were to test people the next day, it is not likely that an exposure from that event would lead to a positive result the next day. That's sort of the point. And in an era in the country where we don't have enough testing, what the guidance has been is, look, if we can't test you, the best guidance is just quarantine yourself. The virus shouldn't incubate longer than 14 days, and after 14 days you shouldn't be carrying the virus anymore, you shouldn't be contagious. But
to see and so much to do now
that are really trying to understand, do we need to wear a mask if we wear a face shield, if everybody's wearing face shields? And maybe that's an alternative to face masks, and some states consider them equivalent. We know that people don't wear masks very well, just as the caller said. People leave their nose out, and that makes the mask not very effective. But everybody who wears a face shield usually wears it correctly, and importantly, they don't touch their face. People who wear masks, including me when I'm wearing a mask, touch my face a lot. It's very different when you're wearing a face shield. So that is something that we think another area with face coverings for the general public that we need to get more data on. But I do think it is a good idea to wear a face shield because eye protection is very important. And we know people, there's even studies that show that people who wear eyeglasses are less likely to get infected because they likely touch their eyes less. So this is something that I think is worth thinking about. When it comes to public restrooms, yes, there is a theoretical risk. We can find the virus that causes COVID-19 in feces. And if you do flush, there is something called a toilet plume that can emanate. So this is a theoretical risk. I don't think it's a major risk, and I myself have not had any issues or concerns of using a public restroom. So I think that that's something that we have to think about, but I don't think it's a major way that people are getting infected. And obviously, if you have a toilet that has a lid on it, if you flush the toilet with the lid closed, you decrease the amount of the plume that's there. And the plume is mostly going to be hitting the person that's actually flushing it. There's probably some aerosolization for other people in the bathroom, but it's primarily the person who themselves is flushing the toilet.
Dr. Georgia, I've taken a couple of coronavirus tests because I'm an educator as well at the college level, and I also took a couple of coronavirus tests when I went to visit my parents in Mississippi. So I want to talk a little bit about coronavirus tests. What do the current tests that we take for coronavirus tell us? And is there one particular test that's better than others, or what should we be looking for?
So there's a lot of different coronavirus tests that are on the market. I'm going to just divide them into two big buckets. So these are people that are infected that you're looking to see what is making my patient sick. If that's the question you're asking, one type of test is called the PCR test, and that stands for polymerase chain reaction. It's a fancy term, but what it means is it's a test that looks for the genetic material of the virus, and if it's there, it tells you it's there. So those are very sensitive. Those are things that usually require experienced lab personnel, and they're more expensive, and they have other ingredients that you need to run them. So that's the main test that people get, PCR tests. And that's what we've had shortages of, that's what we've had problems with. The second type of test is called an antigen test. Antigen tests, almost everybody's had an antigen test. If they've gotten a rapid flu test or a strep throat test, those are antigen tests. And what they do, instead of looking for the genetic material of the virus, they look for actual structure of the virus. So these are more likely to tell you that yes, you've got virus there, yes, you're contagious, and if it's positive, that you can stop there. And these are cheaper, easier, and faster to do. If they're negative, though, you still may have to do a PCR test to decide, why is my patient sick, or what am I sick with? But there has been a move to use antigen tests, not to answer the question of who's sick with something, but for asymptomatic screening to see if people are contagious. Because the antigen is something that's looking at the structure of the virus, and if that's positive, you're likely to be contagious. And the PCR test, if you're positive and you're asymptomatic, we don't know how contagious you are, or if that's just remnants from a prior infection that was very mild, or an asymptomatic infection. So this is kind of a paradigm shift going on. But those are the two big tests that we use. And then the third type of thing is antibody tests, which tell you, did you have exposure to the virus in the past? And those antibody tests are kind of variable, whether they're good or bad, in terms of their sensitivity and their specificity. And the antibodies do fall below the level of detection over time, although you probably still have the antibodies. But it's mostly PCR tests that people are getting, with some antigen tests increasing in their use.
And does it matter does it change anything about the test, the amount of time it takes to get results? Because I know some tests that I've taken take 2 weeks to get back. Some tests I've taken take 48 hours. Now I'm hearing that there are tests that take 15 minutes. Does it matter the amount of time it takes to get the results?
It definitely matters, because we want the test to be useful. So a test result that comes back in 14 days is useless. We shouldn't be paying for those types of tests, because there's no way that that can be an actionable test result. It doesn't help you as the patient, because you're just waiting and you have to self-isolate or self-quarantine for that period that you're waiting for the test result. So you're not able to go about your daily life. And the contact tracers can't even do anything with the 14-day-old test result, because so much of the damage has already been done. So we ideally want test results to come back in minutes. And I think that's the goal, is to have actionable test results. So this turnaround time that we have with some of these PCR tests, when you get an outpatient test, that's unacceptable, and it's not going to make it easy to control the outbreak. This is one of the major flaws in our response, that we can't still do testing as quickly and easily as we need to get a handle on chains of transmission before they spill over into vulnerable populations and land them in the hospital.
Let's go back to our phone lines and let's talk to Ben, who's calling.
And it caused this rift between Baker and the Bush family that took years to kind of really resolve.
Hillary, thank you very much. As Hillary is speaking here, we just got word that Cam Newton, the quarterback for the New England Patriots, has tested positive for COVID-19. That means he will be out on Sunday for the game against the Chiefs. We don't know much more than that. Of course, they have had other issues that have come up in some of these teams. The Titans and Steelers game that was supposed to happen this weekend has been pushed back another couple of weeks. But that's obviously a big name in professional football who's tested positive for the virus. Today was also supposed to be the day, had none of this happened, that the president was going to be in Wisconsin for a very big rally. I think it was scheduled for Green Bay, Wisconsin. Scott Walker is with us right now, the former governor of that beautiful state. Governor, that is not coming to pass, that rally. How do you think this has upended pretty much everything? What are your thoughts?
Well, as if 2020 could get any stranger. I still love the meme that goes back to the future of Marty and Doc. And Doc says to Marty, whatever you do, don't go to 2020. I think that's absolutely true now. Certainly, though, I think most Americans feel, regardless of our politics, our prayers are for the president, the first lady, and everyone, whether it's Cam Newton or any other American, anyone for that matter around the world who's having to deal with this global pandemic. But it will obviously heighten this issue. I think as the president pointed out the other day, and I assume Vice President Pence will mention on Wednesday, Biden and his camp is going to try and jump on this. The fact of the matter is, if we listen to Joe Biden, he was the one complaining about when the scientists told the president to shut down foreign travel from China and other places. Joe Biden attacked it. When the scientists, Dr. Fauci and Dr. Birx, told the president he needed to take immediate action in March, or as many as 2.2 million Americans could die, they did. Remember the flatten the curve? We did that. And so I think it's incumbent upon the president and his allies to get that point out to the American people.
Governor Joe Biden also always wore that darn mask, right? And the president made fun of it before for the debate, but now it looks like the former vice president was wise. Do you think that this comes back? And we obviously will wish the president well, the first lady well, all these folks who lately have tested positive, that we rethink how we go about conducting our lives, watch distancing, maybe wear masks, that there's something here that has changed the dynamic mightily. What do you think?
Well, I think, again, every time you get not just the president, but anytime you mention Cam Newton, anyone else, it stresses just how important it is to be vigilant on this. My wife, Tonette, and I, without any government mandate, have been essentially wearing masks out in public since March. She's a type 1 diabetic. We've always been cautious, but anyone should be, whether they're of a certain age, they're a certain risk factor. We remind our kids all the time that certainly even in the youth, you can transmit that to others or get it yourself. So I think all Americans should do that. But as we look at this, just because the president wasn't always wearing a mask, remember, he was tested and the people around him were tested. Obviously, in this case, there was some breakdown in that system, but it is a good reminder now going forward that no one is protected from this. You've got to be careful in each situation out there.
You know,
Well, first of all, we have to understand that there's nothing to do, really, unless somebody's sick enough to go into the hospital. There's no medication that you would give to somebody who's, in essence, an outpatient, even if they're in the White House. So she just needs to be watched, observed. If her condition were, and I hope this doesn't happen, were to deteriorate, she also would have to go to a hospital like Walter Reed where she could be observed and then be considered for the kind of in-hospital medications like remdesivir and the monoclonal antibodies that the president's currently on. But right now, she just needs to be watched, take care of herself, symptomatic treatment, and clearly she's getting that as we speak.
Is it wise from a medical perspective, doctor, to treat someone with mild symptoms to the extent that the president is being treated? I guess what I'm getting at is, would you, because of medical expertise, be able to make any sort of presumptions, any sort of assessments, thinking that the fact that he is being treated with certain things that we've gone over previously, that would indicate he has, for example, a more severe case of COVID-19 than Melania Trump has right now? Or, in your medical expertise, is it all about prevention and throw as much as you can, as early as you can, and that really is a good way to go about it?
So, Alex, this is a very key question which Dr. Conley should be asked, asked aggressively, because we do, you know, we have a mismatch between what the kind of treatment the president's getting and sort of kind of happy talk about his condition, everything's just fine. If it's just fine, then he shouldn't be in the hospital and be getting these experimental medications that he's on. So something doesn't quite jive here, and I think it's hopefully the journalists in attendance, I know they will attempt to get some answers to clarify that. Either he's sicker than we've been led on to know, or he's being more aggressively treated with these experimental drugs than any other person would be. And by the way, I don't disagree with the fact that we need to take special precautions and be as appropriate and assertive as possible. This is the President of the United States. To make sure he's getting everything that he needs to get at the earliest possible time. But if the mismatch between the clinical presentation, his clinical status, and the kind of drugs they're given is as evident as I think it is, then that is something that needs to be explained by Dr. Conley. We'll see what happens when he comes out there.
So, Robert, to the doctor.
Dr. Sean Conley, physician to the President. This morning I'd like to start by first sharing that the President and First Family, First Lady, extremely grateful for the enormous outpouring of support and prayers that the whole world and country have been providing and sharing. I'd like to thank Colonel Andrew Barr and all the medical and support staff here at Walter Reed for their tireless efforts, providing everything and anything the medical team, the President, and I could need. This morning the President is doing very well. Behind me are some of the members of the President's medical team, whom I'd like to introduce. Dr. Sean Dooley, Pulmonary Critical Care. Dr. Brian Garibaldi, Pulmonary Critical Care. Dr. Robert Browning, Pulmonary Critical Care. Dr. Jason Blaylock, Infectious Disease. Dr. Wes Campbell, Infectious Disease. Dr. John Hodgson, Anesthesia. Major Kurt Klein, Army Nurse. Commander Megan Nasworthy, Navy Nurse. Lieutenant Juliana Levopa, Navy Nurse. Lieutenant Commander John Shea, Clinical Pharmacist. And not present with us are Lieutenant Beth Carter, Lieutenant Maureen Meehan, both Navy nurses, and Dr. Jesse Schoenau, Director of our Executive Medicine Program. and Dr. Jesse Schoenau, Director of our Executive Medicine Program. As reported yesterday, in consultation with this group, I recommended we bring the President up to Walter Reed as a precautionary measure to provide state-of-the-art monitoring and any care that he may need. Just 72 hours into the diagnosis now, the first week of COVID, and in particular days 7 to 10, are the most critical in determining the likely course of this illness. At this time, the team and I are extremely happy with the progress the President has made. Thursday, he had a mild cough and some nasal congestion and fatigue, all of which are now resolving and improving. At this time, I'd like to bring up Dr. Dooley to discuss some of the specifics of the President's care.
Thank you, and good afternoon. I'm Dr. Sean Dooley, as Dr. Conley mentioned. I'll start off by mentioning what an incredible, how incredibly proud I am of our medical team assembled behind me in the honor it's been to care for the President over these last 24 hours here at Walter Reed. He's receiving outstanding multidisciplinary care, the state of the science for coronavirus infection. We are monitoring him very closely for any evidence of complications from either the coronavirus illness or the therapies that we are prescribing to make him better. We have monitored his cardiac function, his kidney function, his liver function. All of those are normal. And the President this morning is not on oxygen, not having difficulty breathing or walking around the White House medical unit upstairs. He's in exceptionally good spirits, and in fact, as we were completing our multidisciplinary rounds this morning, the quote he left us with was, "I feel like I could walk out of here today," and that was a very encouraging comment from the President. Moving forward, I'll go ahead and introduce Dr. Garibaldi, who will talk about some of our...
Thank you, Dr. Dooley, and I'd like to echo the sentiment from the entire team. What an honor and a privilege it is to be part of this multidisciplinary unit to care for the President. About 48 hours ago, the President received a special antibody therapy directed against the coronavirus, and we're working very closely with the company to monitor him in terms of that outcome. Yesterday evening, he received his first dose of IV remdesivir, and our plan is to continue a 5-day treatment course for remdesivir. And the big plan for today, since he's in such great spirits and doing well, is to encourage him to eat, to drink, to stay hydrated, to be up out of bed, and to be working and doing the things that he needs to do to get well. And I'll refer Dr. Conley to any. To eat, to drink, to stay hydrated, to be up out of bed, and to be working and doing the things that he. Refer Dr. Conley to any questions.
Thanks, Brian. It's important to note the President's been fever-free for over 24 hours. We remain cautiously optimistic, but he's doing great. With that, one other note. It should be clear that he's got plenty of work to get done from the Chief of Staff, and he's doing it. With that, if there's a couple questions about the President's health in the last couple days.
Sir, can you tell us the President's oxygen saturation level, please?
Yeah, so the last saturation that we had up walking around, he was about 96%.
He's receiving no, he has not received any supplemental oxygen?
He's not on oxygen right now, that's right.
He has not received any at all?
He's not needed any this morning, today at all. That's right.
Do you have an estimated date when he might be discharged?
Well, I don't want to put a hard date on that. He's doing so well, but with a known course of the illness, days 7 to 10, we get really concerned about the inflammatory phase 2. Given that we provided some of these advanced therapies so early in the course, a little bit earlier than most of the patients we know and follow, it's hard to tell where he is on that course, and so every day we're evaluating, does he need to be here, what does he need, and where's he going?
Is the probability that he will need supplemental oxygen going forward?
I don't want to put a percentage on that, but right now all indicators are that he'll remain off of oxygen going forward.
And in terms of like blood clots, pneumonia, bacterial infection, what do you see as the risk on that front?
Well, we know that all of them are risks associated with this condition. He is receiving all of the standard of care and beyond per routine, international COVID protocols. So we're monitoring for all of that, but at the moment, there's no cause for concern.
You said
it's Friday morning. He's had none.
Okay. And what was the date on top of the other antibodies?
I'm sorry?
Why remdesivir on top of the antibodies?
So remdesivir works a little bit differently than the antibodies. We're maximizing all aspects of his care, attacking this virus, a multi-pronged approach. As the president, I didn't want to hold anything back. If there was any possibility that it would add value to his care and expedite his return, I wanted to take it. And the team agreed, and that's why we proceeded.
Doctor, what was the date of the president's last negative test?
I'm not going to get into all the testing going back, but he and all the staff routinely are tested, and so.
Doctor, what is the PPE protocol for President Trump receiving visitors and doctors?
It's the same as any hospital has. We have an area that's clean, that you put your equipment on, and then beyond that, everybody is fully gowned up, masks, gloves. We're protecting ourselves and him.
Have you done a screen? Has there been any sign of any lung damage whatsoever?
We are following all of that. We do daily ultrasounds, we do daily lab work. The team is tracking all of that.
Has there been any sign of damage, sir?
I'm not going to go into specifics of what the findings of any of that are.
If we just go down on one thing, has he ever been on supplemental oxygen?
Right now, he is not on oxygen.
I know you keep saying right now, but should we read into the fact that he had been previously?
Yesterday and today, he was not on oxygen.
So he has not been on it during his COVID treatment?
He's not on oxygen right now.
Has hydroxychloroquine been considered as a viable treatment option for the president?
We discussed it. He asked about it. He's not on it now.
Hydroxychloroquine been considered as a viable treatment option for the president?
We discussed it. He asked about it. He's not on it now.
And in terms of symptoms, has he also experienced difficulty breathing?
No, he has not. Never did. He had a little cough. He had the fever. More than anything, he's felt run down.
Who is handling contact tracing? Is that the White House or CDC?
The White House Medical Unit, in conjunction with, in collaboration with CDC and local state and health departments, are conducting all contact tracing per CDC guidelines.
When was the positive diagnosis made? You said 72 hours. That would put that Wednesday.
Yeah, so Thursday afternoon, following the news of a close contact, is when we repeated testing, and given kind of clinical indications that a little bit more concern, and that's when late that night we got the PCR confirmation that he was.
Is there any clarity on how he became infected?
Not going to go into that. As far as his care, it's irrelevant.
Or when he became infected?
Yeah, we're not going to go into that. We're just tracking his clinical course and providing the best care we can.
Will President Trump have to stay at Walter Reed to get the 5-day remdesivir treatment?
We've discussed that right now. If he needs all 5 days, that will likely be the course. But again, every day we're reviewing with the team his needs for being here. And as soon as he gets to the point where it's not a requirement, he may still need some care, but we can provide that downtown at the house. Then we will transition at that point, as long as it's safe and appropriate and the team agrees.
In addition to his weight, does he have any other risk factors that make him more at risk for sort of a severe case?
Well, not particularly. I mean, he's 74, he's male, and he is slightly overweight. Other than that, he's very healthy. His cholesterol is great, his blood pressure is great, he's not on medication for that. He's up and active. You saw his activity, the days leading up to, the long hours and everything else. He's able to handle it.
Can you provide other vitals like heart rate, blood pressure, and temperature?
So his heart rate is in the 70s to 80s. His blood pressure has remained where it's historically been during our physicals. 110 to 120 is systolic. He's great. It's never budged. I've had no concerns there.
So why was the decision made to transfer him here?
Because he's the President of the United States.
And obviously, if doctors have found that the prone position is helpful for COVID, has he been in that at all?
No, he asked about that. He did, Thursday into Friday. He's been briefed by the task force and all the scientists for months And he brought that up, as we were discussing his cough. And at that time, his oxygen levels were okay, and we didn't feel like we needed to do it. We came up here, we discussed it with the team as well. We consider all options, but he has not needed any of that.
Why wasn't the First Lady admitted as well?
The First Lady's doing great. Thanks for asking. She has no advanced therapy. She's convalescing at home. Thank you.
I'm going to try to pin you down one more time. I know you said there's no oxygen yesterday.
He's not on oxygen
but did he receive
today.
Did he receive any on Thursday?
And what's today? Saturday? No, Thursday.
Okay, so no Thursday, no Friday, no Saturday. That's fine.
So
that was why we were confused.
Thursday, no oxygen, none at this moment. Yeah, and yesterday with the team, while we were all here, he was not on oxygen.
So has the president actually been admitted as a patient to this hospital?
The president is a patient at Walter Reed National Military Medical Center.
Is he on any steroids?
Yes.
Press, thank you.
Thank you very much.
Last question. Thank you. Okay, thank you.
Okay, there you have it. The first briefing on the president's condition following his admittance to Walter Reed Medical Center for treatment of the coronavirus after his diagnosis on Thursday.
Was yesterday 1 a.m. when the world learned about the president's testing positive for COVID-19. So what did you hear there? What struck you as interesting? Dr. Conley underscoring that the president is not on oxygen now. He kept saying now, but then he also said not yesterday, and that he's doing exceptionally well.
Yeah, Fred, it was almost more about what he wouldn't answer versus what he did, right? The timeline struck me as well. So he said it's been 72 hours since his diagnosis. So here we are on Saturday morning. So, 73 days ago, is that when the diagnosis was? Because as you point out, we didn't hear about it till 1 o'clock in the morning on Friday. I'm getting my days mixed up as well. But the point is that doesn't jive with what we've heard for the diagnosis.
Right.
Sorry,
he also,
you can hear me.
Oh, yeah. I know the audio was a little funny there. Go ahead. Yeah.
The oxygen thing was really relevant. I mean, this is not a small point. And the reporters, whoever was asking the questions, followed up several times. Was he on supplemental oxygen or not at any time? And for some crazy evasive sort of thing, the doctor just wasn't answering that. And I just found it really odd to say that. I mean, was he specifically told, do not admit that the president was on oxygen? Because, again, this is a medically relevant fact here. And then the issue that we raised before the briefing started about testing. And again, the reporter asked the right question was, when did he last have a negative test? And again, right, and he would not answer that question either. Even at the end, right when they ended the press conference, someone asked about some of the therapeutics like steroids, and again, no answer. So, it's really hard, Fred, when you have these situations, because once you start to detect that someone's being evasive with you, it does throw into question everything else as well. I've interviewed so many of these doctors taking care of the president, and it's always this sort of thing. Ronnie Jackson did the same thing. Would not be forthright about information. You really had to pin down, come back over and over and over again. This was not I'm glad they did this press conference, but it wasn't really helpful.
Yeah.
And I'm not sure how much of it, frankly, we can totally rely on in terms of this information.
Yeah, it almost seems like the objective was really to convey everything's all right, as opposed to conveying, filling in the blanks that so many would have about the president's condition, the urgency of getting him to Walter Reed. His answer was, yeah, he's the president of the United States. What do people who are around the president need to know? Perhaps there's information that we need to impart, and we didn't receive it there. So I think I'm hearing from you, there's a little disappointment in what was not heard today from these doctors.
Yeah, was he on supplemental oxygen? Has he had any lab tests that would show concern about his heart? Someone asked about, has he had any evidence of lung damage? And he said, well, he's gotten ultrasounds. That's not an answer to the question, right? I mean, you don't need to be a doctor to know that's not an answer to the question. Does he have viral pneumonia? I mean, these are, if you're going to come out and brief the public about the health of someone, in this case the president, those are very reasonable questions that were being asked, but unfortunately not answered.
Yeah, Dr. Conley also saying, the president's up and walking around. He's going to be able to do the things that he needs to do. Gloria Borgia, you talked about the importance of transparency. That was lacking a lot of transparency.
We're in the event that you're looking at right there, the Rose Garden event, exactly a week ago, where the president celebrated his nomination of the Judge Amy Coney Barrett to fill the seat vacated by the loss of Ruth Bader Ginsburg. Kellyanne Conway, the president's advisor, former advisor, testing positive. We learned Bill Stepien, his campaign manager, another name that we've heard about. As I turn to you, though, I want to just get your sense of this moment, and this sort of moment of uncertainty for so many Americans, exactly 1 month out from a presidential election, as we wait for better understanding about the president's condition right now.
And I'll be honest with you, as a layperson, you know, what I took away from that briefing was more uncertainty, not certainty or stability. I got a lot more uncertainty there. I mean, we're basically in suspended animation in this campaign a bit. We know the president. We're now at least till Wednesday or Thursday of next week before we know the next step of when. I think that was, to me, the big takeaway here is that he's not getting out of the hospital any sooner than the middle of next week, if not later than that. And that just takes up sort of more space of the calendar and obviously gets us further away. And I do think, Peter, it calls into question, where should Vice President Pence be? I noticed that he has a very, very busy schedule that they've put on him. Apparently he's supposed to fly to Utah beginning on Monday and be traveling a lot. You have to wonder, while the president's in the hospital, while they're monitoring him so closely as they are right now, should he be traveling so much? Should he be circulating and putting himself at risk of getting the virus, or should he be holding up a little bit more at the Naval Observatory, taking extra precautions and maybe doing a remote debate? So that to me,
estimates are that as many as 10% or more of patients with COVID-19 may even suffer that long haul syndrome and have some degree of symptoms lasting weeks or even months. It is way too early to look down the road that far. It's certainly in an inpatient hospitalized setting, we're looking at patients basically hour by hour.
Okay, Jen Ashton, thanks very much. This brings the city of Vega as well, our senior White House correspondent. She's at Walter Reed right now. So Cecilia, apparently the president got this test now Thursday afternoon. What we also know about Thursday is that that's when Hope Hicks that morning, his close aide, tested positive that morning. And the White House and the president chose to continue to go on to that series of meetings in New Jersey with both a fundraiser and a roundtable after knowing that Hope Hicks had tested positive and when they knew the president was about to get a test and was symptomatic in some level.
Yeah, George, the message here from the doctor, and excuse me here because the traffic is very loud on this road, but the message here from the doctor today at Walter Reed was very much, and you would assume that the president had something to do with this, that it is as business as usual as much as can be as possible there in the hospital. The president is still doing work, that the president is very well, that they are extremely happy with this progress. But you said it. Right now, there is a very alarming thing happening with the circle around President Trump and the growing number of positive cases that we are seeing. You mentioned Hope Hicks. We just learned that former New Jersey Governor Chris Christie, an ABC News contributor, has tested positive. We know that he was in the debate prep with the president. We know that he was there in that Rose Garden event a week ago today, where the president announced his pick for the Supreme Court justice for Ruth Bader Ginsburg's replacement, Amy Coney Barrett. The big question right now, George, is whether that event that happened there in the Rose Garden has become a super spreader event. We know that Kellyanne Conway overnight announced that she also tested positive. She's experiencing mild symptoms. She also was at that event. And the list goes on, George. 2 Republican senators, one from North Carolina, Tom Tillis, another from Utah, Mike Lee. They've also tested positive as a result of that. And then the circle that's growing, the Republican Party chair, she's now tested positive. The campaign manager, George.
Thank you very much for all of that. I'll knock that up. The professor of health metrics of the Institute for Health. The upshot here is a very good report on the President of the United States, his first full day now at the Bethesda Medical Center there, where it looks like he's doing very well, very, very upbeat. And the indications are that will continue to be the case here again. It looks to me that the next 5 days at least he will be there. We know a little more than that outside of its upended Washington, where we're similarly getting talks, though it could be upending it in a good way. Progress on a stimulus measure, and also full steam ahead on that Supreme Court nomination hearing for Judge Amy Barrett. What a crazy week. And it's only been 1 week. Bill Hemmer is next.
All right, you heard it there a moment ago. You heard about President Trump's condition, his medical team saying that the president is doing well, but that they do not yet want to put a hard date on when he may be discharged. I'm Bill Hemmer. Good Saturday afternoon. This year, a special edition of Bill Hemmer Reports, and for the next 2 hours, we will take you through what we're learning about the president's condition and just about every issue that surrounds it. The virus, the election, the Supreme Court battle, the economy. First, the doctors giving a fair amount of information a short time ago, most of it positive. Fever-free for 24 hours. The president telling his doctors, quote, "I feel like I could walk out of here today." In summary, they say he's doing great. We have our own doctor on standby to react, but first want to get the latest from Walter Reed and Leland Vittard at that post today to explain more about what we're learning and the treatment there for the president today. Leland, good afternoon.
Bill Hemmer, good afternoon to you. It seems as though they are really encouraged, the medical team for the president, by the 2 experimental tip-of-the-spear treatments, the remdesivir, which the president's going to take for the next 5 days, and then the Regeneron antibody treatment that one of these doctors said he began about 48 hours ago, which, if all of that is true, would mean that he was getting antibody treatments before he was putting out tweets saying that he tested positive, something to keep an eye on. Big things that we learned is the symptoms that the president has had: nasal congestion, cough, and fatigue. Those seem to be the really big things on Thursday that he was experiencing, as well as a fever. Now his doctors say that he is doing much better.
This morning, the president is doing very well. At this time, the team and I are extremely happy with the progress the president has made. Thursday, he had a mild cough and some nasal congestion and fatigue, all of which are now resolving and improving.
In terms of medicine,
on Monday, we just confirmed. And so from a travel perspective, the campaign is rolling on. What has changed, though, Alex, is the tone. This race reached a fever pitch on the first debate stage earlier last week. Now, though, the tone is completely different. The Biden campaign saying this isn't a moment for politics. Listen.
We can get this pandemic under control so we can get our economy working again for everyone.
But he's having no luck getting,
the public, not just the press, everybody, because the president tweeted out, 1 a.m. that he had tested positive, and the doctor would then reveal that perhaps it was much earlier than that, the potential exposure, not even potential, the exposure that the president, had on so many other people. To know how dangerous, this disease is, this virus is. Now you're bringing into question the intent. What would be, the president's motivation of not sharing with people the truth of his positive test?
Well, it's certainly, Fred, it's his modus operandi, right? That's how he has acted throughout his whole presidency. It seems like that's how he has acted throughout his whole business career. He hasn't been very open. In fact, when he gets called on the carpet for it, when he's actually told what you just said is not true, he's very dismissive of it, and you had noted this just a moment ago. He downplays it, because if you don't think about it, and if you don't look at it, if you don't discuss it, guess what? In his mind, it doesn't occur. Well, guess what? It has occurred, and that's where we are right now, unfortunately.
For vaccines that may need to be kept very cold, the work of reaching different communities, as well as the work of engagement.
This underscores just how dangerous and how serious this situation continues to be around COVID-19. As for Vice President Mike Pence, we are told, as you reported earlier, that he and the Second Lady have tested negative again today. They are at the Naval Observatory. I am told today, and of course watching this all very closely, the former President Barack Obama, who tweeted yesterday, Michelle and I hope that the President, First Lady, and all those affected by the coronavirus around the country are getting the care they need and are on the path to a speedy recovery. So what we really saw yesterday, Peter, was a bit of a pause in some of the bitter rhetoric. Now, the question becomes what happens next. President Trump, of course, has canceled his campaign events, the campaign hoping that he will be able to resume some virtually once he is feeling better. It's our understanding that at this point in time, the vice presidential debate
is still scheduled to take place. But as you heard from Chuck, look, this is really going to be day by day. The vice president is going to have to make some decisions about whether or not he feels as though it's appropriate to travel once it gets closer. So the political world really watching and waiting to see what happens next here.
Kristen, thank you. So the headline for the president's doctors this morning, that he is, in their words, doing very well. There will be much more throughout the day on the networks of NBC and online at NBCnews.com. For now, we will return you to your regularly scheduled programming. I'm Peter Alexander in Washington. This has been an NBC News Special Report.
Ready?
Tears or dislocations, turn to the orthopedic.
Mrs. Pence, they both tested negative for coronavirus. They get tested daily, and there's been a lot of talk about who the vice president would or would not have come into contact with. Of course, the vice president, very busy himself. He is scheduled to hold a conference call with the coronavirus task force later this afternoon. That's going to be happening at the Naval Observatory. That's the vice president's residence just a few miles up the road. Next week, the vice president is still scheduled to go to Salt Lake City for his debate one-on-one with California Senator Kamala Harris. We also have learned that the vice president's going to be stepping up on the campaign trail. He's going to be holding an event in Arizona on Thursday. As you know, President Trump has postponed his in-person campaign events for the time being. The president was supposed to be in Wisconsin today. Meantime, First Lady Melania Trump, she remains here at the White House. We got an update on her condition from the doctors during that news conference after she tested positive along with the president. We also heard from her spokesperson earlier today. They say, quote, Mrs. Trump is doing well. Her symptoms have not worsened and she continues to rest. She remains in touch with her husband. She is thinking of all who are ill and wishes them a speedy recovery. Now, of course, we've been trying to work backwards here, figuring out exactly who has tested positive, who hasn't. We also, in addition to the president and first lady, we know that the advisor, Hope Hicks, as well as campaign manager Bill Stepien and former counselor Kellyanne Conway. She's no longer a White House staffer, but she was spotted at the Supreme Court nomination a week ago, the one that was Saturday at the Rose Garden. She tweeted out overnight, tonight I tested positive for COVID-19. My symptoms are mild, light cough, and I'm feeling fine. I have begun a quarantine process in consultation with physicians. As always, my heart is with everyone affected by this global pandemic. Kellyanne Conway, who again is no longer a White House staffer, but she was spotted here just a week ago. We also have learned that former New Jersey Governor Chris Christie has tested positive. He was here at the White House last week when the president held a news conference on Sunday night. That was as they were getting ready for the debate, that first debate with Joe Biden. Chris Christie was in the briefing room, seated right next to Rudy Giuliani, as well as White House Press Secretary Kayleigh McEnany. Governor Christie says he is going to be going to speak with his medical officials a little bit later on today, and then we'll update the appropriate people. As we've been here at the White House, I haven't seen anything different, Bill, from coming into work today. You go through a Secret Service checkpoint, people have their masks on, but they're not doing temperature checks. It is a Saturday, so there are fewer staffers around, and we in the White House press corps, we have our masks on when we're going inside the White House press briefing room. Other than that, it really does seem to be business as usual around here. Bill?
Okay, Mark, thank you. Going to come back to you next hour. We'll get a sense of whether or not there's any change in protocol there. Mark, thank you. All right, let's bring in the doctor, Mark Siegel now, professor of medicine, NYU Langone Medical Center. And you were listening to the briefing. There was a lot of positive news in that, doctor. Go ahead and give us your evaluation from the medical side now.
Well, first of all, for our viewers, Bill, I have heard the same thing through people close to the president last night. So obviously doctors have their reputations on the line, but they're seeing exactly what the president has been telling his own friends that have gotten to me, that he's feeling a lot better. You heard from Dr. Conley that the fever is gone, that he's not coughing right now, that he's breathing well. There seems to be a lot of fascination over this issue of oxygenation, and I want to put that away. Let me tell you how simple this is, Bill. If you have an oxygen saturation level of 96%, that is totally normal, and you don't need oxygen. There's only two reasons we give oxygen to patients. One, if the oxygen saturation level is low, and two, if someone feels uncomfortable. Neither of those two reasons are occurring. That's why he's not on oxygen. There'd be no reason for him to be on oxygen. The next point I want to make is about remdesivir. There seems to be a little bit of confusion on that. That drug is given for either a 5 or a 10-day course. It looks like the president is getting it for a 5-day course. That's the way it was studied and found to be most successful, decreasing the rate of recovery from 14 down to 11 days. Now, remdesivir is given intravenously once a day, Bill. He started it on Friday. To me, and I don't have any inside sourcing on this, to me that would make Tuesday the red letter day of whether they would maybe send him home or consider it middle of next week. Why? Because why would they give him remdesivir in the White House? Of course they wouldn't. They would give it in Walter Reed, where they can closely observe the response to an intravenous medication that appears to be working quite well. The combination of the antibody treatments he had to block the virus, to decrease the viral load, and now the remdesivir, which blocks the virus from replicating, those two things can potentially, from studies, decrease the risk of long-term complications. As Dr. Conley said, Bill, we're looking over the next week. That's the magic week to see that he doesn't have the inflammation and the blood clotting that we are concerned about with COVID-19.
And on that point, a source familiar, just getting this in here now, a lot of this news is developing by the hour. There's news on the Senate, there's news on the NFL. This is the follow on the president's condition right now. His vitals over the last 24 hours were considered very concerning, and over the next 48 hours will be critical in terms of his care. We are still not on a clear path to a full recovery. You've been dealing with other patients for 6 months now, doctor. How do you evaluate that statement?
It's because of the fact, it's a very important statement, it's because of the fact this is an unpredictable virus. I've seen many COVID patients, and I saw them up on the COVID ward, where one day they're completely fine, and the next day they're in the prone position. You heard that question, what about the prone position, where you breathe better. I saw a 90-year-old up on the COVID wards that was fine one day, the next day had to go to the ICU, and then the 2 days after that she was fine and went home. It's completely unpredictable, and that's why not completely unpredictable, I wouldn't say that. I think it's predictable based on what we're seeing with the president, but close observation is key because it's cyclical and it can change on any given time.
What I take from that then, doctor, is this is still day to day. Is that accurate?
That's completely accurate. And I also felt that the team that Dr. Conley assembled there were keeping a very close eye on not just the COVID-19 situation, but the reaction to essentially experimental treatments. That's also day by day, and it looks like he is tolerating the remdesivir, but again, close monitoring. Oxygen, again, is not the key thing here, although one of the things everyone out there knows is we watch very, very carefully how SARS-CoV-2 virus affects the lungs, because it can be quite damaging to the lungs. But you heard the doctors talk about the kidneys, the liver, the lungs, also the heart. We watch every major organ in the body to be careful because this is a multi-system disease.
Okay, doctor, thank you. We're going to come back to you next hour. We'll get more information on this then. In the meantime, there's a lot of reaction to this, as you can imagine. Celebrities and politicians after the news of the COVID diagnosis. Alex Hogan is tracking all that today. She joins us now on what she is picking up across the country and the world. Alex.
Hi, Bill. Lawmakers around the country are reacting, sending their best wishes to the first family. Of course, many of them saying that they've reached out themselves, but also releasing statements. Some governors across the country say on top of their condolences, this is a warning that the pandemic is far from over. New Jersey Governor Phil Murphy saying in part, if there's only one thing we have learned in New Jersey over these months, it's that we pull together to support everyone fighting this virus. Michigan Governor Gretchen Whitmer stating this virus doesn't care if you're rich or poor, a Republican or a Democrat, young or old, no one is immune, not even the president. And celebrities are also weighing in. Cardi B tweeting at the president, quote, bet you want to wear a mask now. And Alyssa Milano reacting, quote, as someone who has had COVID-19 and still suffers from post-COVID syndromes, I can honestly say with all that I am that I wouldn't wish this virus on my worst enemy. Please wear a mask. Of course, senators also reacting, all of them just wanting their best for the president as they await. Of course, we found that news earlier this morning of what to expect from the president, that he is doing well today. As of right now, we know that more than 208,000 Americans have died from COVID-19 and more than 7.3 million have been infected in the U.S. Phil?
Alex, thank you. Alex Hogan on that. Meanwhile, Chad Pergram reports from the Hill that Senator Mitch McConnell has...
We're getting the possibility, because Dr. Conley refused to say he wouldn't look backwards at when the president's COVID tests, when he was asked about when did he first test positive, he said, I'm not going to go backwards, if you recall, or something to that effect. So it's possible that he first had a positive indication on Wednesday, before, importantly, that very large Minnesota rally in Duluth with all of those people and not masked. He didn't engage with people on the tarmac coming off as he normally would with greeters. So maybe already they were trying to be careful, but there were people on Air Force One, including Hope Hicks. So we've seen, going back to Saturday, that Rose Garden event could very well, within the window of infection and results being noticed, in the testing. Again, that Rose Garden event with all those people glad-handing after the event, the receptions then indoor events in the diplomatic reception room. We've seen White House photos and pool photos by the great photographer Doug Mills in the diplomatic reception room. With people, we can see, I see Maureen Scalia talking to Judge Barrett in one of those still photos. Those are indoor events, not even the Rose Garden event, and also there were events up on the state floor, we understand. I believe in the state dining room or the East Room. So there was a lot going on there after the public event in the Rose Garden, and we already know that 2 senators who were there. We know that Bill Stepien, who was involved with the president in debate preps that weekend, the campaign manager, and now Chris Christie has announced, former governor, who obviously also has comorbidities, as the president does, from being overweight and being in that age category. Chris Christie is quite a bit younger, but the president, of course, by being 74. Of course, it's very good that the president is walking around and walked to the helicopter. Very good that they say, he is not on oxygen now, is not compromised, that his lung function is good, 96% oxygen. They did now give blood pressure ratings, which were good, heart ratings, which were good. I'm not a doctor, but have been, covering these things for so many years that the indicators are all good in that regard. But being in the hospital, they can monitor his other functions much better than they could, of course, at the White House. So it's clear he's going to be there for a couple of days, and there are a lot of political ramifications. I just want to also point out, we just saw the statement from Mitch McConnell, whereas here, putting the Senate in pro forma session for floor votes until October 19th. So they're delaying any floor votes unless a 24-hour call back. So there will be virtual hearings, and that Lindsey Graham is proceeding on October 12th with a judiciary hearing for Supreme Court justice virtually, because they have 2 members of the committee, and they are in a very short timetable initially. Before this even happened, they could only afford to lose 2 more Republican votes for a floor vote, and they're going to proceed. But they won't be voting on the floor unless there's some emergency session for any COVID relief. But they are going to proceed with this very rapid schedule, but they're now going to take a break from any kind of floor actions. So you've got 3 senators now with COVID, and you don't know how many more will be diagnosed. There were a lot of senators present at that Rose Garden event, and with the president for the rest of the week.
Yeah. So there are both political and medical ramifications to all of this. So to you, I ask the political question, Andrea. What might be the fallout for this president? First, if there is a lack of transparency, how that will be disseminated, how people will feel about that across the country, if not around the world. And also among his supporters, the base of Donald Trump, many of them are absolutely loyal to him, and be that as it may, do you think that the fact that he has been stricken with COVID-19, maybe because he flaunted the prospects of not wearing a mask and saying repeatedly that he wasn't afraid of it, and any number of other things that have been chronicled over these last months, might this have a detrimental effect to his base of support in these last critical 30-plus days before the election?
I would say, based on everything we've seen, because we don't have any polling data yet on this, that it will not, in terms of the base support, that a lot of sympathy will be engendered and concern about the president's health. And certainly if he battles through this successfully, it could be a plus for him with his base. But I think with people on the fence, with a lot of suburban women who have been evaluating how they're going to vote, if they're going to vote, may not be happy with Joe Biden, not happy with some of the president's behaviors, that this is possibly, a demonstration that this disease is a serious disease, and that wearing masks should not ever have been a political statement. The viral load for anyone infected with this disease is a lot worse for someone who has not used face coverings, and so the president himself now faces the risk that his infection would not have been this serious or as serious as it could become, because after the first few days, that's the critical point where we see which way this thing is going. If he'd been wearing face coverings. And as well, Dr. Fauci only said last month in his testimony to the Hill that they're first beginning to see really disturbing signs of long-term real problems, cardiac problems, inflammation of the heart among people who have survived COVID. We don't yet know all that much about this disease, so it's not something to be trivial about. And I think that certainly the other factor here is that he's off the trail. He's a very effective campaigner with the base. Those rallies are his meat and potatoes. He can't do that now.
No, he cannot.
Joseph asked why it took beat up so...
Love each other so much and eating, you're solving. We've got
painful muscle and joint soreness.
Target 2 and target 3 follow on fairly quickly, and the reason
together for you. This is him explaining later in the video why he's been out on the hustings campaigning when he was told, you should just stay in the Oval Office, stay in the White House. He's making the case that no, I'm a leader, I have to confront the situation. Now, earlier in the tape, he said he's doing better. He thinks the next few days will tell the story, but he's feeling good and he thanks everybody. Good indications. But this part of the video arguably matters more, because at some point it can't just be about him, it's got to be about what his situation means to the rest of this country. And here's what's really clear in a very confusing situation. He should have stayed in the Oval Office. He should have stayed in the White House. That is what we were asking the rest of the country to do. Sure, he's an essential worker, but how you do the job matters also. Instead, he went out and did exactly what we were asking everybody else not to do. And he did that because he said that the information was bogus, that the pandemic was a hoax, that masks were weakness, and everything was going to be fine. He said nothing ever comes from our events, nobody gets sick. We don't know that that's true, and in fact, we now know it's not true, based with what we're dealing with right now. In all likelihood, this president's flouting of the advice that he just admitted he was given, that made sense from every clinician and every expert under his control, now has him in the hospital. Please take that message to heart. He's the best evidence that what he was telling you about the pandemic was wrong. Now, we've got to figure out what is right when it comes to what to understand about his own situation. Let's begin with White House correspondent John Harwood outside Walter Reed Medical Center. John, good to have you on with me. Thank you for taking the opportunity to do so. Is it true for you as well that this has been an unusual circumstance of conflicting information coming out from people who should be on the same page?
Absolutely. We're more than 2 days, Chris, from when we learned that the president had coronavirus. We still do not have a clear timeline of when he acquired it, when his diagnosis was confirmed. We don't have a clear explanation of his condition or his prognosis. We had this very confusing and comically evasive press conference by his doctor at Walter Reed today, where he attempted to paint a rosy view of the situation, but wouldn't provide any details, wouldn't say how high his fever had been, wouldn't say whether he'd taken supplemental oxygen, although we subsequently confirmed that he did. Didn't say whether he'd sustained any lung damage. After that, you had a White House official come out on background, later identified by the AP and the New York Times as Mark Meadows, the chief of staff, say, well, his vitals were of significant concern yesterday, and the course of his disease is going to be determined in the next 48 hours, not out of the woods, that sort of thing. Then finally, we got the videotape from the president himself tonight, 4 minutes long. And I thought that, and I'm interested in what you think, Chris, because you've known Donald Trump longer than I have, but I thought we could see a real note of vulnerability in that tape where he said, I'm starting to feel good, but you don't know. Watch the next couple of days. I thought that was more revealing of that moment than anything the doctor told us at the press conference today.
Well, usually he understands something very well about messaging, which is show no uncertainty. Say that things are true, whether they are or not. If you repeat it enough, people will believe you. And certainly his success to this point is testament to that. He has been qualifying things since he got sick. I think I'm going to be good. They tell me this. We'll see. That is an unusual level of qualifying for him. But I'll tell you what, he's not denying that he's sick. And as somebody who had it, everybody's case is different. And what I'm hearing about him does not match up with mine. When you're sick, you're going to know it, John. And this is a scary thing because nobody can give you great answers. Even as President of the United States, I know who he's talking to. And they don't know things about this. So you get spooked fast. And that's going to show in anybody. I mean, he's a human being like everybody else. My bigger concern is what he's still insisting on saying. Telling people, John, they told me I should stay in the White House. They told me I should stay in the Oval Office. But no, a leader confronts a situation. That's why I went out and held rallies. It was probably the worst thing to do as a leader.
Right, and there was a ton of baloney in that videotape as well. The whole idea about him being advised to stay in the White House, but he chose to go to the hospital. We know he doesn't like hospitals. He was reluctant to go. His aides wanted him to go, and that was the right decision because given the unpredictability of this illness, as you know better than almost anyone, you can take a turn very rapidly, and if you're a 74-year-old man who's overweight, it's a dangerous situation, and the right call was made. He was convinced to go. He was able to walk out under his own steam to Marine One and head up here to Bethesda. So the right thing happened in the end. His description of how it happened was not quite right.
First off, I'd like to wish the first family well and speedy recovery. I think that should be coming out of everyone's mouth before they drop their 2 cents. I also thought former VP Joe Biden, I thought his tweet was respectful, and that's how you treat a great and worthy opponent. As an athlete in football or wrestling or whatever the sport I was playing, when I hated the guy I was going against, but if he went down, I'd be the first one to help him up, to walk him off the field or clap when he got up. So I think we need to remember what's important in this country. We can all battle over our ideals, but when it comes down to it, no, you never want to see anybody you love or disagree with take ill with such a serious thing like COVID. So hopefully it's a wake-up call for all of us to stop fighting over little things and start appreciating each other a little bit. So that's what I would hope. And I think we're going to see the best out of both candidates in this situation. I think we'll see the fight in President Trump. I think we'll see some class from Joe Biden, and it'll be a lot easier to go to that ballot knowing that we'll see where real leadership is in the next 30 days. I think it honestly is as difficult as it is to hear anyone getting COVID. I think this is going to be a learning moment for this country and a chance for us to come together.
That's a great point. Excellent. All right, up next, we'll talk about this week's amazing debate. I can't wait.
Certainly what's going to happen a week from now.
Yeah, thanks, Shannon. That's NBC's Shannon Pettypiece starting us off tonight. Let's continue now with Dr. David Shulkin, the former Secretary of Veterans Affairs and a practicing physician. Secretary Shulkin, good to see you tonight. Welcome.
Glad to see you.
What did you make of the video that the president posted this evening?
Well, it was certainly good to see the president speaking comfortably, generally looking well, but I sure would have liked to have seen some empathy in the way that he spoke. You know, 205,000 people who had his same illness aren't with us today. And certainly a lot of families and a lot of people have suffered. And we didn't see any real empathy coming from the president about this. You know, when people who are famous get an illness, particularly the president of the United States, this is a teaching moment, Joshua. This is an ability to explain to others something about this illness. And, you know, here's what we know. This is an illness that's spread through the air. This is an illness that, despite the testing that goes on in the White House, like nowhere else in the country, even with all those negative tests, we still saw a spreading event last Saturday. This is a virus that clearly can still spread outside. This was an outside event. And so you shouldn't be having events where there are lots of people together not wearing masks. And this was the opportunity for the president to share with the nation what we know about this virus, how to save lives, how to create something out of this illness that becomes a national strategy. We just didn't hear any of that.
Talk to us a little bit about where President Trump is being treated. The Walter Reed National Military Medical Center. What makes that different than, say, treating him at the White House? We're told that the president can get quite a high degree of care at the White House.
Yeah, the White House has a full medical unit, has every capability, but there's nothing like the president's unit at Walter Reed. When you go there, it's an entire floor devoted specifically to the president. It has about 6 rooms. It has the full capability of all hospital care, but also full intensive care right in that unit, so you wouldn't have to move if you had to. It has the kitchens. It has dining rooms, office space, and it really is an extraordinary unit. You saw the 10 physicians and nurses that came out who cared for the president. These are incredible people where you get care. And in fact, you know, most Americans who get coronavirus, now 7 million of them, don't get access to that type of care, that type of team, the types of medications that the president has access to. And so many Americans who are getting this virus are now wondering, how do I get that type of care?
Yeah, it's just one of the kind of remarkable things for people who have never been there. You know, Walter Reed sits right outside of Washington. It's basically across the street from the headquarters of the National Institutes of Health. It sits right next to the Uniformed Services University, which is basically a military medical school. There's a medical, dental, nursing, public health, allied professions school. So you're in the middle of this huge federal/military medical complex like nothing else on the planet. Also, the president is getting access to these treatments from Regeneron and getting treatment for remdesivir. What do you make of those two options, particularly since they're not fully approved, fully vetted for general use for everyday people?
Yeah, first of all, I couldn't agree with you more about Walter Reed. This is a real national center of excellence. And in fact, Walter Reed himself was the one who discovered about yellow fever, another virus. So it's pretty interesting that this is where the president's being treated for a virus. But in terms of the treatments that the president's receiving, both of these are relatively experimental treatments. Remdesivir, of course, has a emergency use authorization, but it's a new antiviral that was developed for Ebola, now being tested on COVID-19. But the Regeneron monoclonal antibody has really not been used widespread before. So this is really state of the art, and we're seeing how that works. But of course, you know,
So it is an inning-ending double play. And we do go to the 9th inning, tied at 2.